Over the past year and a half, there has been a significant increase in the number of people experiencing mental health problems. According to the CDC, during August 2020 to February 2021, the percentage of adults with recent symptoms of an anxiety or a depressive disorder increased about 5%, and the percentage of those reporting an unmet mental health care need increased another 2.5%. Those increases are the largest among adults ages 18 to 29. Now, Carrie Mull, Director of Clinical Services for Behavioral Health at Mercy Health, is here to share what we can do about mental health and what services Mercy Health has to offer. Good morning, Carrie.
Hello.
Thanks for being here. Can you tell us, just off the top here, the most common mental health issues that you see?
Yeah, consistent with what the CDC is saying, we also see depression and anxiety as two most prevalent diagnoses.
And when it comes to people who are struggling with anxiety or depression, someone who maybe someone themselves, someone's concerned, how would one know? What should they do?
You know, there's three ways that you can tell that you may be struggling with depression and anxiety that is different from the normal everyday ups and downs or the normal worries. And depression and anxiety, when you're struggling with those two illnesses, it can completely take over your physical symptoms. You may not be able to sleep, or you're sleeping too much. That impacts your ability to eat. You may be not able to eat or eating too much, and it completely takes over your physical symptoms and thoughts. Depression and anxiety also last much longer. So you almost are constantly struggling with those symptoms with little relief, and they can come on with little or no warning. And there's no real reason that you can pinpoint that would say, oh, this is why I'm depressed, or this is why I'm anxious. And so there's two things really that I want people to know. Mental health care is just health care. Right? So if you're struggling with these symptoms, just as if you were struggling with chest pain or a broken leg, you seek medical attention, right? So you would call your primary care doctor. If you're struggling with those symptoms, call your primary care doctor, and they can help you navigate through the, intimidating, maybe complex mental health system. If you don't have a primary care doctor, no worries. You just log into mercyhealth.com, find a physician, and you can easily be connected with one. Because your primary care physician will connect you to a mental health professional.
Now, when it comes to mental health and physical health, I think you make a good point there. They are so intertwined. They are the same. Your physical health and mental health are so connected. So what services does Mercy Health offer those in need?
Yes. So Mercy Health, both in the Grand Rapids area and Muskegon, have easily accessible mental health professionals right within the primary care offices, so you don't have to go to a separate place, and they're truly a part of your care team. We believe in integration, so we do not separate mental health care with medical health care. They're easy to access.
You know, a lot of this sometimes can lead down a pretty dark path, and people start down the thoughts of suicide. I know that you guys have a hotline for that as well, right?
Yes, absolutely. And that is another thing to remember. If you are feeling like maybe you don't want to live anymore, that is a medical emergency. So you can call 911, or you can also call the Suicide Prevention Lifeline, and the number is 1-800-273-8255. Another important thing to note is depression and anxiety are treatable, no matter the severity. Mild to severe, they are treatable. So it's important to get help.
And also, that anxiety and depression can lead to substance abuse, right? And I know that you guys serve that community as well.
That's right. And it can be so interrelated, right? So it's just all of those things are treatable, and it's important to get help. You can call your primary care physician again, or talk with family, friends, coworkers. But it's important not to suffer in silence.
Absolutely. Carrie, I think the main point we're taking away from this is take action, reach out, get help through your primary, through the website right now at mercyhealth.com/mental health. A lot of different resources out there, but the most important thing is make sure if you or someone you know is suffering from these signs of depression, anxiety, substance abuse, reach out. It is treatable and get help. Carrie, thank you so much for the time this morning.
Thank you for having me.
Absolutely. For more information about mental health services offered at Mercy Health, just visit mercyhealth.com/mental health. And if you need a primary care provider, visit mercyhealth.com/find-a-doctor.